My name is Arun Tiwari and my breakthrough is reducing side effects due to antipsychotic treatment. The current approach to treating schizophrenia patients is a trial and error approach where the patient is started on a particular antipsychotic. You have to wait for 4 weeks to look at whether the person is responding or not. And then if the person is not responding, they are moved on to a second medication. The patients tend to develop side effects such as antipsychotic-induced weight gain, diabetes, cardiovascular diseases, and early mortality. Our primary aim is to treat the patient with the best available medication. These side effects are an unavoidable part of this treatment. Studies have shown that we can save up to like $35 million a year by reducing side effect burden. In the lab, we have developed this test where we have combined genes that are involved in the metabolism of drugs, and these variants, when combined together, can predict which patient will develop antipsychotic-induced weight gain and which patient won't. Our goal is to develop an early intervention which helps the doctor in better treating the patients. It's a very simplified way of looking at the results. There is no scientific jargon involved. There is a coding for green, yellow, and red bin, which helps the physician in deciding which drug to use to treat a particular patient. If a particular patient is on a red bin drug, he can be moved on to a green or a yellow bin for better outcomes. And this will help doctors in using interventions which will prevent the development of obesity in these patients. In the future, what will happen is the moment the patient comes into the hospital, the physician sees the patient and then the patient is asked to give a saliva sample which will be shipped to the lab, and within 24 to 48 hours, the physician will have the results of the test and they can look up the red, yellow, green bin, and depending on that, they can prescribe the drug. We have very promising results. So we believe that in our this randomized clinical testing that we are doing, this will prove that our model is valid and the patients will have a better outcome and there would be lots of healthcare savings.